everybody, my name is Laura Phelps. I work with Streetworks Outreach Collaborative. I'm one of the collaborative administrators. I'm here today to talk about Narcan and how to help a person who is overdosing. So thank you so much for learning about these steps. It's so important to helping people in our communities. I just want to thank anyone that is carrying Narcan. Narcan is a gift of love. It's a gift of compassion. So thank you for carrying this life-saving medicine with you. So now we're going to learn how to administer nasal Narcan. If you've ever used nasal medicine before for allergies or sinus and cold symptoms, you are going to be a pro at nasal Narcan. So when we're getting ready to use nasal Narcan, we are assessing the situation to see whether an overdose is occurring, doing that quick sternum rub to check for non-responsiveness. When we have determined an overdose is occurring, we're going to grab our box of nasal Narcan. Each box contains 2 doses. So we'll open that box, grab one of the plastic wrappers that has the cartridge of nasal Narcan inside of it. This is 1 dose of nasal Narcan. We'll get it out of the wrapper by pulling the foil back off. Then we'll remove the plastic cartridge from the plastic wrapper. The way that we hold it would be putting 2 fingers on either side of the nozzle and our thumb on the plunger. When it's time to use it, we will put it up to the person's nostril, into their nostril, and then pushing the plunger here to fully dispense the medicine into that person's nostril. This is 1 full dose, so fully dispense this entire amount into the person's nostril. It is something that is absorbed through the mucous membranes, so you don't have to worry about a person deeply breathing this medicine into their lungs. As soon as this medicine hits their nostril, it will be absorbed into the mucous membranes that line the person's nose. So after you administer this first dose, go back to your training where we give 1 dose of Narcan, rescue breaths, waiting 2 to 3 minutes to see if that person's condition has changed. Narcan, rescue breaths, waiting 2 to 3 minutes to see if that person's condition changed or help has arrived. So it might take more than just 1 or 2 doses of this, so just be prepared to go back and forth on those steps. Rescue breaths, Narcan, 2 to 3 minutes. So next up, we're going to learn how to do an intramuscular shot. And this can be kind of scary for some people if you don't normally use syringes. But just take a deep breath. We're going to save somebody's life today. So we'll get over our feelings on those syringes because we do need to respond to this person in a timely manner. So just take a deep breath. It's okay if this feels a little abnormal to you, but we're going to learn how to get through it and save a person's life. Now we're going to learn how to administer an intramuscular dose of Narcan. So to prepare for this, first we're going to get our shot ready. So we're going to open our Narcan bag and we're going to pull out this little vial of Narcan. With this little vial of Narcan, we're going to remove the orange cap. And you'll see that underneath the orange cap is another cap. We've got a silver cap that has a rubber stopper in the center. This rubber stopper prevents medicine from spilling out, so the medicine will not come out of this vial until you draw it out with a syringe. So we've uncapped our vial of Narcan. Now we want to get our syringe ready. So getting the syringe, and we're going to unwrap it from the plunger side, not the sharp side. So first, getting that out of the wrapper. Now this syringe, you'll notice it has an orange lock on it. So once we are done using it, we can just slip the orange cap over the syringe tip, which will effectively cap it, so we don't have to worry about poking ourselves. But as we are getting ready to load the syringe, we will pull the, you want to tighten the hub here where the syringe tip screws into the barrel. Otherwise, you will just pull the whole syringe tip off of the barrel. So now we are going to pull the clear cap off. Setting that aside, now we have a sharp needle. So be very careful. Do not point it at others, and communicate with everyone around you that you have a sharp syringe in your hand. Next, we're going to take the vial of Narcan and we're going to tip it upside down. Then, while holding the syringe in one hand, the vial of Narcan in the other, we're going to carefully put the syringe tip just inside the bottle of Narcan. You want to have the tip of the syringe just inside the bottle so that the tip of the syringe is underneath the medicine line, because if we have the syringe tip too far, then it will be above the medicine line and we won't actually pull any Narcan into the syringe. So you can barely see the tip of the syringe because I have it just barely inside there. So now we're going to hold the barrel and we're going to hold the plunger, just drawing all the medicine possible down into the syringe. All right, so I've got as much as I can get out of there. So we'll pull the vial off and set it aside. And then you can see I have some air bubbles in here. So we're going to flick it with our finger, and then we're going to push the plunger so that we get rid of as many air bubbles as possible. Then we're going to go up to the individual. Depending on how many layers that they have on, we may need to pull their arm out of their jacket so that we have a more clear shot to their bicep. You can even pull the sleeve up so you really get close to the person's bicep. And then you are going to administer the shot of Narcan. For the sake of training, I'm not going to administer this to myself, so I am going to cap it and set it aside. But when we go to the person's shoulder, we'll just find the edge of the shoulder, placing 2 fingers underneath where that bone ends. And then right on the third, right underneath where our second finger is, that's where I'm going to administer the shot. This needle is not really as long as our minds would make us think it is. So this is a very short needle, in fact. This one, I would still only need to go about halfway to really get to my muscle. So as you are administering this dose into the person's bicep, pushing with the plunger to completely dispense all of the medicine that is in this barrel into the person's arm. This is 1 full shot of Narcan. Once you have given that person the shot, you can set that one aside. Then going back to the person, checking to see if there has been any change in that person's condition. If there has not been, you go back to rescue breaths, second shot of Narcan, waiting 2 to 3 minutes until that person revives. If they still have not come out of it, you go right back. Rescue breaths, third shot of Narcan, waiting 2 to 3 minutes to see if that person's condition has changed, or in case paramedics have arrived and can take over for you. So rescue breaths, Narcan, 2 to 3 minutes. Rescue breaths, Narcan, 2 to 3 minutes until they revive or until help arrives to take over for you. Okay, next we're going to talk about the importance of fentanyl test strips. Fentanyl test strips are something that became legal to carry, to purchase, to distribute July 1st of 2021. So this is completely legal to have on you. It's completely legal to buy them. You will not get in trouble. These used to be considered drug paraphernalia, but now they are considered part of our safer use toolkit. Because when you use these, you have more awareness about the substance. This will test for the presence of fentanyl in a substance. This will not tell you how much fentanyl is in that substance, but it will tell you if it is in there. It only tests for fentanyl, so it does not test for any other substances. With fentanyl, you kind of have to think about it as chocolate chip cookie dough, because fentanyl does not, it is not evenly distributed in a substance. So it might be sometimes that you for this analogy, take a bite of a chocolate chip cookie and you don't get any chocolate chips in it. That would be like if you were using a substance and you didn't get a little bit of fentanyl in it. So fentanyl, while it is not evenly distributed in that substance, if you are testing every time before using that substance, you might have a negative the first time, negative for fentanyl the second time, but then on the third time, you could end up having fentanyl in it. So it is important to test every time you are about to consume that substance, because you could have a negative the first time, but it could be the second or third time that has that fentanyl in it. Fentanyl is basically just a little dipstick. So when you open up this wrapper, this is what the fentanyl test strip looks like. This is the part where you're able to hold it with your hand. This is your testing window right here. And this is the water line. So you would want to dip it in, you want to dissolve your substance in a little bit of water and then dipping it only up to that first blue line. So there are a couple different ways to use fentanyl test strips. You can do a residue test. This would be if you had a baggie that had your substances in it, you could pour out the substances on a safe, clean surface, and then you can just test the baggie. So we would take a little bit of, saying that this was like our little drug bag, you would take a little bit of water, put it in the bag, and then based off of the residue that is already inside of that bag, we'll take that fentanyl test strip, dip it inside there, swishing it around for just 15 seconds. So you can basically sing happy birthday to yourself. Then after those 15 seconds, you want to pull it out and just set it aside. It will take about 30 to 60 minutes to process to get that positive or negative result. So give yourself 30 to 60 minutes, then you should start to see some lines that are going to be forming here. I can already see very faintly, we're getting 2 pink lines right there. So looking at our fentanyl test strip packaging, we can see 1 line is positive for fentanyl, 2 lines negative for fentanyl, and then you can also get an invalid reading. So if you have a 1 line that's at the bottom or no lines at all, that would mean that you have an invalid reading. So when we're looking at this, we can see that the little baggie does not contain fentanyl in it. Even if it's a very faint line, that would still be valid for a negative result. Another way that we can test is by taking a clean vessel, clean cup of some kind, and then grabbing a small amount of the drug itself. So this is my Dayquil. So we are going to test this Dayquil to see if it contains fentanyl. So I've already broken this pill in half so that I can get a couple granules off of it for testing. So we're going to drop just a couple granules of this pill into this bag. So a person could test pills, they can test powders. They just have to get a few granules of it into that bag. And then you want to have a dipstick or a stirring device that you can use to dissolve that substance into the water. Once you have it dissolved into the water, you'll again put your fentanyl, and I'm just reusing this one, but you'll put your fentanyl test strip into that water just up to that blue water line. Again, singing happy birthday to yourself because you'll be testing for 15 seconds. After those 15 seconds, you'll pull that out, and then you'll be waiting about another 30 seconds to a minute until you get your reading. Right away, you'll see that first pink line, that's your control line. The second line is going to be your test line. So 2 of those means that my Dayquil is negative for fentanyl. It can sometimes be hard to tell how much water that you need to use, but you want to use just enough so that it dilutes the substance or pulls enough of the residue off of the bag. If you use too much water or too little water, you could get an inaccurate reading. So make sure you have just enough water to dissolve the substance for the testing. But then this would let us know that this does not contain fentanyl, the amount that we are about to use. So we would be able to safely consume this without having fentanyl in that. Fentanyl test strips are something that you can get locally here if you go to Steve Remler Hope Network. They provide fentanyl test strip kits for free. You can also order them online. We tend to go with this manufacturer, BTNX. They've been reliable. People have used them and had good experiences with them. So BNTX is the distributor if you wanted to order them online. Otherwise, if you're in the Twin Cities here, you can get them from Steve Remler Hope Network, and Southside Harm Reduction also carries them. So know what you're using, be safe. Fentanyl test strips are just an additional tool for that safety. Next, we're going to talk about what happens if you find a pill. So I tend to search everything on the internet. I Google everything. If I find a pill, it's no different. I Google what it is that I'm seeing. So describe what it is for your keywords. Round, oval shaped, what color is it? Are there any words printed on it? So round, blue, OC80 is what we Googled when we were looking up this pill. And this would tell us that it's an Oxycontin, though it doesn't really tell us if it's a real pill or not, because this could still be a fake pill, especially if it isn't purchased from a doctor or a pharmacist. So we can do a Google image search to see if it's a good fake, but it's not a fentanyl test strip, so it will not tell you if it has fentanyl in it or not. So still be careful if you did not buy that from the doctor or from a pharmacist. Once you know what you are looking at, then you can also Google what that pill is plus recreational, and you can see why someone might be using it for ulterior uses. There are things like gabapentin. This is a medication that is prescribed to people as a mood stabilizer and to help for folks that are chronic pain sufferers. But if you end up taking 2,500 milligrams of that medication, which is way more than what is prescribed, it actually can have opiate-like effects for the person who consumes it. So if you're seeing a lot of a pill and you're wondering, why am I seeing this? Google it. Google what that pill is plus recreational, and you could find ulterior uses for that medicine. Next, we're going to talk about creating a drug use safety plan. So these are just things that you can bring up in conversation with someone that you know, someone you love, or someone that you're working with. If you are noticing that maybe they are using substances and just need to be maybe more prepared in case something bad happens. So these are just some talking points that you can go over with somebody. First, do you have Narcan? Narcan is the quickest, easiest way to save a life if they are overdosing. And it shouldn't be carried by just someone who is knowingly consuming opiates. Everybody in the world should be carrying Narcan because we are all impacted in some way by substances, whether we know the person who is consuming those substances or whether we're just a person walking in the world. We may come across somebody who is in need of that Narcan. So everybody should carry Narcan. It is a life-saving medicine. The next point is, what method do you use to get high? So is a person smoking their substances? Are they snorting them, injecting them, swallowing them? It's good to know how a person consumes the substances because then we can talk about if they have their own paraphernalia to use. Everybody should have their own paraphernalia because this is a health and safety measure. If we aren't sharing paraphernalia, that means we aren't sharing bloodborne pathogens. That means we aren't sharing COVID. So when we give a person their own utensils or paraphernalia to use with, then we're decreasing any health risks or health hazards. Next up, do you know where to go for wound care? So when people don't know where to go for dignified and respected wound care, they can neglect those wounds. And if we neglect wounds, then they can turn into an even greater issue. So we want to make sure people know where they can go for non-judgmental, non-shaming medical care. All of the syringe exchanges in the Twin Cities area can perform wound care to some degree, and they have good relationships with other clinics that can provide that non-judgmental wound care. Next up, are you using alone? A person who is overdosing cannot Narcan themselves. So it's important that we have somebody that can respond in that moment of need. So whether the person has a friend that they're using with, or there's even a hotline now called Never Use Alone, and you can just call up this hotline as you are preparing to get high, and they'll stay on the line with you just to make sure that you are safe. And if you overdose, they call an ambulance on your behalf. So it's really cool. Everybody has a partner with this hotline. When using with others, make sure that everyone knows about Steve's Law. So if you're using in a group, make sure that people know Steve's Law provides limited immunity for folks who are a person who is overdosing and a person who stays behind with that person who is overdosing. So Steve's Law says, don't run, call 911. It will protect you. When using with others, make sure that everyone knows how to use Narcan and where it is located. I always have Narcan on me, and I usually have a button that says I carry Narcan. So whether I'm talking about it or if I have this button, people know that they can come to me for Narcan. It's not helpful if I keep it a secret though. So they might see my button, they might know that I have it, but they have to know where I have it. So if you are with a group of people, if you're carrying Narcan, just let people know. Let people know they can rely on you in case somebody overdoses. This one is kind of a question that's getting more into exploitation. So how is this person paying for their substances? And is there anybody that is harming them or exploiting them due to their dependency on a substance? To go through withdrawals feels terrible. So when someone who has the withdrawals happening, they can be susceptible to exploitation, and someone who does not have that person's best interest at heart could take advantage of them so that they can give them substances so they feel better. When a person is withdrawing, they feel very uncomfortable, so a bad person can come along and take advantage of that feeling and supply a substance and get them to do something that they wouldn't normally want to do because they feel so sick from the withdrawals. So if you know somebody, love somebody, or are working with somebody who is using substances, just check in with them. How are you paying for your substances? How can I help you so that you don't have to go through that in your life? A person who uses substances still has their autonomy, they still have their bodily rights, and nobody has a right to take advantage of that. Next up, do you have someone that you trust, that you can talk to in case something bad happens? And this is really just, again, that a person who uses substances still has their autonomy. They still have the right to their boundaries. So it's great when they can check in with somebody who understands that and can reaffirm that. Do you have someone you can trust that you can call in case something bad happens? The last one here, when was the last time you were tested for bloodborne pathogens? Because wouldn't it be great if we got through this moment in our life free of any bloodborne illnesses like hepatitis, HIV, and we can move on with our life without having those ongoing health complications. So this next slide really demonstrates the importance of getting a new syringe for people every time they're about to use. The first image is of a brand new needle. The second image is of a needle that's been used once. The third image, it's been used twice. And the bottom image, it's been used 6 times. So you can see the point on that needle progressively gets more dull. And in fact, it starts to curl in on itself. The surface is no longer smooth, so you can see there's little burrs on that syringe. Those will tear the skin as a person is using them, and that just increases the risk of infection. So it's so important that we get new needles for people every time. Next up, we're going to talk about some information about busting the myths that are out there. So there's a lot of misinformation in the harm reduction movement, and really this information is created to cause hysteria and to cause hesitation when a person is responding to an overdose. So first up, we're going to talk about fentanyl. Your hands are fentanyl proof. If I had some fentanyl, I could pour it on my hands, I could rub it around, and it would be fine. My hands, my skin is fentanyl proof. I do have hangnails, so I wouldn't want to touch it with my broken skin. I wouldn't want to touch it to my mouth, my nose, or my eyes. But if I just had it on the palm of my hand, I would be safe. There are news reports out there of people coming and responding to a person who is overdosing and that they overdosed as well in response. And this is just not true. Fentanyl is not an aerosoled substance. It is not something that when a person is overdosing, it seeps out of their pores. Fentanyl is fine. Like if you're responding to a person who's overdosing, you're gonna be fine. There are times when people have felt something in the moment when they are responding to a person who's overdosing, but this is more than likely anxiety, and it's more than likely a bodily response to the adrenaline rush that you are getting when responding to that person. So when you hear things about a person overdosing when they responded to a person who was overdosing, just think a little bit more deeply about it. Check your resources, check to see who wrote that article, because oftentimes when these articles come out, it is from people who are trying to hurt the harm reduction movement. Because again, when we cause fear, we cause hesitancy, and then that hesitancy can cause death, because we do need to respond to people who are overdosing in a timely manner. So really check your resources, vet your resources, make sure that what they are saying is accurate and true. You cannot overdose from fentanyl just by responding to another individual who is overdosing. That is false. Next up, there's a lot of talk about marijuana and fentanyl. Marijuana and fentanyl are substances that are smoked in different manners. So if you've ever seen somebody who is smoking fentanyl or an opioid, usually there is a barrier between the flame. So the substance is usually on a foil or can be smoked in a glass bubble. But if you have fentanyl on the foil, the person is lighting it from below, not from above like they do with marijuana. Fentanyl is not a heat sustainable source, so when there is direct flame touched to fentanyl, it is burned away and it is eroded. So there has been a lot of misinformation out there about marijuana that contains fentanyl. And this is just to say that even if somebody put a little bit of fentanyl on some marijuana, the process of consumption and the process of smoking the marijuana, it would burn off the fentanyl. Because if a person is smoking marijuana, they have the dry herbed flower, then they would put fentanyl on top of that. As you spark a direct flame to that source, you're going to burn away the fentanyl and you're going to burn away the effectiveness of it. Marijuana can be consumed in a lot of different ways. So even if a person was making edibles, whether it was a baked good, a gummy, a hard candy, if they were making THC edibles, the process of manufacturing it would burn away the fentanyl. So even if a person put a little bit of fentanyl in some brownie batter or a gummy or a hard candy, as you are heating it up and baking it, you would erode away the fentanyl, making it non-effective. If a person was vaping their marijuana and they added fentanyl, the sustained heat through the vaping process would burn away the fentanyl and make it not effective. So all of this information on this slide is essentially to say marijuana and fentanyl are consumed in different ways, and the way that marijuana is consumed would burn off and make the fentanyl not effective, so you would not overdose on it. Again, read your resources, vet your resources. If people are saying that folks are overdosing from fentanyl, there could be a reason behind that. Recently, there was an article where 6 students in Connecticut overdosed from smoking marijuana joints or marijuana cigarettes that had fentanyl in it. And this was inaccurate. It was false. And the news source, when I think of it, I wonder if they are trying to close down dispensaries because Connecticut is a recently legalized state for marijuana. So vet your resources, try to know who is saying this, and try to think of why they are saying this. It could be to harm the harm reduction movement. So again, marijuana and fentanyl, not as much of a concern. Now we're going to get into some resources. So I did mention just a little bit ago, this first resource, Never Use Alone. This is a hotline that you can call, and the person on the other end of that line is just a volunteer who wants to make sure that you're safe while you're consuming your substances. So call them up as you are preparing to consume that substance. They'll do a brief intake with you. They just want to know where you're located. You don't have to give them your real name. You could just tell them, I'm Britney Spears living in South Minneapolis. You could make up a totally fictitious name. They just want to know where you're located so that if you become non-responsive, that they will call an ambulance there to your location to help out. So it's really great. Canary is the next resource that you can use if you don't have someone to use with. Canary is an app that you can download to your phone. It has 2 functions. If you don't have a Wi-Fi connection or a data plan on your phone, it really just functions as an alarm. So if you are about to use a substance, like if you're about to get high, you would activate this app. So you can see on the slide, it's the yellow image that has a red and a black button on it. When you activate it, the black button has a little timer on it, and it will count down the seconds. As it gets to 0 seconds, it's going to prompt you to either tap the screen, tap that red button, or shake it. If you fail to do those things, the app is going to think that you are non-responsive and it will sound an alarm. So everyone in your direct proximity will hear this alarm and hopefully be curious and come find you. If you do have a Wi-Fi connection and/or a data plan, the app actually has a second function where you can load a pre-designated contact into the app as like your safe person. So when you are about to consume that substance, have that emergency contact loaded into the app. And then as you activate the app, it will count down those seconds when it prompts you to tap the phone or deactivate the app. If you fail to do so, it sounds the alarm and it sends a text message to your friend just saying, hey, you got to come find me. I'm not doing so good right now, or I'm unresponsive. So it's really cool. 2 options. If you don't have somebody that's with you to get high, you can either call this hotline or you can have an app on your phone that will act as a friend that's there with you. So really cool. I just love technology. Next, we'll go through some different syringe exchanges and treatment options that are in the Twin Cities. The first one up is Aliveness Project. They're in South Minneapolis on Nicollet. They primarily serve folks who are living with HIV/AIDS, but they also recently opened a syringe exchange program as well. So you can go to them for care coordination for HIV/AIDS services, but also they can help out with syringe exchange services. So new needles, they can take used needles, and they can provide Narcan for you. The next up is Alliance Wellness Center. They're located in Bloomington. They actually provide culturally specific resources and services for folks who are East African, Somali. The executive director, Yusuf Shafi, is East African himself, and a lot of his staff are also East African. So it's really great when you can have a person who maybe has lived your life and can understand where you're coming from, and can and create some services to wrap around and really see you holistically. Next up, there's Clinic 555. So this is a syringe exchange that is in St. Paul. They're located in the Ramsey County Public Health Building. They can do wound care. They can do STI, HIV testing. They have a syringe exchange, and they can provide Narcan too. Then next up, we've got the Indigenous Peoples Task Force. They are also a culturally responsive agency. So if you're working with, knowing, or are a person who is Indigenous, Indigenous Peoples Task Force can be a really great resource for you. They do wound care, Rule 25, chemical dependency assessment, connection to housing, connection to community. Just really great option. Next is North Point. North Point is located in North Minneapolis on Broadway. You can go there for a syringe exchange. They can also have a connection to treatment options, and just a caring and concerned person that you can check in with. Next, we have Rainbow Health. Rainbow Health has a location in St. Paul, and then they also offer syringe exchange services in Minneapolis. You can go there for STI testing, education, wound care, Rule 25, chemical dependency assessment, and they can provide safer use supplies, whether that's safer injecting supplies, safer smoking supplies. You can drop off used syringes there, and you can pick up Narcan there. Then we have the Red Door Services. So Red Door Services, they have a reproductive health clinic that's located at the Hennepin County Public Health Services building. But in addition to reproductive health options, they also offer syringe exchange. So you can pick up new needles, discard old needles, and you can pick up Narcan, get wound care treatment there, and just talk to somebody. We also have Southside Harm Reduction Services. These folks are great. This was a grassroots outreach option that really rose up from the Indigenous community. They have a couple leaders that decided to do community cleanup in case they saw syringes on the ground. They do mobile delivery of supplies. So if you aren't able to get to a syringe exchange, you can call Southside Harm Reduction, and they can actually bring the supplies to you. So really great. They also do a lot of community education and community events. So really love the folks at Southside Harm Reduction Services. Then we have Valhalla Place. So they're not so much a syringe exchange, they're more of a treatment option. So if a person is looking for a medication-assisted treatment, which would be something that would help with any withdrawals. Sometimes it can be scary or intimidating for a person to go to treatment because they're afraid of how the withdrawals will feel. So if you are connected with Valhalla Place, they could actually prescribe methadone or Suboxone, which would help curb those withdrawals and those cravings. So there can be options so that quitting process is less painful for the person. But Valhalla Place has 4 different locations around the metro, so you can find whichever location is most convenient for you. And then next, there's the chemical dependency assessment. So a Rule 25 chemical dependency assessment is basically a questionnaire that a person would take about their patterns of use, the substances they're using, and then just how detrimental that has been to their lives. So just kind of talking about your daily life and how substance use is affecting that. The Rule 25, after you do those questions, it makes a recommendation on treatment options for you. So if you're looking to get into treatment, Rule 25 chemical dependency assessment is going to be that first step. All right, and then just closing, I just want to thank you all for being a part of this and watching, and really just I thank you for having the compassion and love for folks in our communities that are struggling with substance use, because we all need each other. We all do better when we all do better. So thank you for taking the steps and learning how to keep people safe.